You're 38. You're sleeping 8 hours a night, but wake up exhausted. Your brain feels foggy, and you have new, unexplained aching joints. When you mention this to your doctor, the response is usually the same. They say you're stressed, you're working too hard, or just getting older. But those exact physical and mental symptoms are often the first biological markers of early perimenopause. Perimenopause is a distinct physiological transition period that begins years, sometimes a full decade before the final menstrual period. Because these early warning signs are physical rather than strictly reproductive, they are consistently misinterpreted. Without a clear biological label for the exhaustion or joint pain, women are left to navigate years of worsening symptoms and self-doubt alone. Culturally, we are taught a very specific narrative about this phase of life, that menopause happens around age 50, and it consists almost entirely of hot flashes. This chart shows the disconnect between expectation and reality. People presume symptoms begin in their late 40s, but data shows they frequently start as early as 35. This transitional phase can last 4 to 10 years before a woman reaches her final period. This knowledge gap has serious clinical consequences. A woman might seek help for sudden heart palpitations or severe anxiety, only to have those issues treated as isolated, primary conditions. Because her age doesn't match the cultural expectation of menopause, doctors frequently categorize the root cause as busy mom syndrome or a primary psychiatric disorder. The failure to recognize perimenopause as a decade-long systemic event means millions of women move through this transition without the medical support they actually need. To understand why these symptoms happen, we have to look past the external symptoms and move down to the cellular level of the ovaries. Inside the ovary, the lateral reserve of available follicles shrinks with age. Consequently, production of a peptide called inhibin drops. Inhibin normally provides a feedback signal regulating stimulating hormones. Without this biological break, brain hormones spike erratically, trying to force the ovaries into responding. During early perimenopause, estrogen levels fluctuate through an unpredictable series of sharp peaks and deep valleys. This erratic hormonal volatility creates the physiological stress that drives these confusing early symptoms. These symptoms are widespread because estrogen receptors are clustered throughout the entire body, in the brain, heart, joints, and gut. When hormone levels bounce wildly, these receptors lose regulation. Clinical studies show this disruption creates a significantly higher risk of new-onset depression and anxiety. This receptor disruption is also why a woman might experience joint aches, digestive bloating, or severe insomnia long before she notices any changes to her menstrual cycle. If you are experiencing this, know that these physiological changes are entirely real. They are measurable biological events. Recognizing these disparate symptoms as a unified, systemic reaction to hormone fluctuation is the first step toward finding targeted relief. Enduring a decade of these disruptive symptoms is not a medical necessity. This chart shows the effect of systemic hormone therapy, or HT. It is currently the clinical gold standard for stabilizing these chaotic fluctuations and relieving systemic symptoms. Modern formulations typically use low-dose systemic estrogen paired with a protective progestin. Progestin is a synthetic hormone that ensures uterine safety by preventing the overgrowth of the uterine lining during treatment. For those unable to use hormones, there are proven alternatives like specific SSRIs, which are medications typically used for depression, or gabapentin. Gabapentin is an anti-seizure medication that has been shown to improve sleep and reduce hot flashes. Be cautious, however, with trendy, at-home hormone tests. Because your hormones are fluctuating wildly day to day, a single snapshot is rarely accurate. A clinical diagnosis must be based on the pattern of your symptoms over time. While perimenopause is a natural transition, navigating it with meticulous symptom tracking and proactive medical advocacy is essential to reclaiming your quality of life.